Okay, we're going to try and find Megan Bendinelli from Live Well Collective. Drum roll, please. Waiting. Hi, Stace. Thanks for joining, Stace. Megan's in clinic today, by the way, so she's going to come running in hot from a patient appointment in her scrubs, most likely. So let's see. Let's see if she's there. Always fun. Invite. Trying that again, because you never know. Oh, hi. Megan, I just invited you. Request to be in your live view request. Go live. Let's see if this works.
There you are. I was like, I'm here, I see you.
You know what it is that people always join, but I think when you join, you can't be invited. But I don't know. I figured it out.
Yeah.
This is what happens when you're in your late 40s and you're trying to be cool, like all the
Cool
the kids.
people.
Yeah.
Like all the cool people.
Like all the cool people. Look at that lighting. Look at you.
Look at you. That's what I was saying. The other day when I saw you, I was like, I want to glow like you.
See this mug? Do you see this mug? Anyway, hi. I know you're in between clinics, so I let everybody know. I'm like, she's coming in scrubs.
I'm coming in hot, guys. I'm coming in hot.
But you did your hair today.
I did, just for you guys. Just for you. I want to let you know. This takes a lot.
That's amazing. I braided. I did a braid for you. Sorry.
I appreciate it.
Yeah. Okay, well, I know that you have so much to share today, and we are so grateful for you being on. And as I do with all of our guests, do you mind if I do a quick bio introduction? And then you can, because I feel like you need to absorb how much you've done, and it just kind of sets the tone.
Okay. Let's do it.
So by the way, background is Megan and I met at Oprah, which you can't say about everybody. So we are Oprah friends.
We are. We were just destined to be.
Yeah, we kind of were, in the sense that we both got sat in the front row, which was totally wild and unexpected. And then it was this kismet kind of moment where that was it. It was like, oh, you're my Oprah friend.
Yeah, forever bonded by Oprah. Thank you.
Yeah, I think I cried. I mean,
I know. Yeah. I remember us walking in, and you're like, I might cry. I'm like, it's okay. I got you.
Yeah.
I mean, you also had a lot. You had your own trio.
Yeah.
So that was also cool.
Yeah, it was good. It was really good. So that is how we are friends. That's why we are here today, is our shared love of all things menopause. And so Megan Bendinelli, who is a kindred spirit in this journey of women's health, is a board certified nurse practitioner who has dedicated her entire career to women's health. One of my favorite things about you and learning about kind of who you are in this journey is that you began as a labor and delivery nurse. And I feel like, I don't know, all the other moms who are listening, that labor and delivery nurses are angels put on this earth. I'm not even kidding. You're a different archetype. And so be an L&D nurse is, I don't know, thank you for everything you do to bring babies into this world safely. And then
I do miss it. It was probably one of my favorite. That and like doing IUIs and like reproductive endocrinology. I always would like walk in being like, all right, let's shoot it up. Let's make a baby.
It's truly, it's miracle, right? Like it truly is this miraculous thing. And I'm just so grateful that you did that for so many women for so long. And then you evolved into endocrinology and infertility. And then subsequently, of course, endocrinology and infertility, leaning into obstetrics and gynecology for many, many years. And then all of that culminated in this, I mean, at the expense of being Oprah, it's like this aha moment where you founded Live Well Collective,
Mm-hmm.
and you're the
And this was a fluke. I thought I was going to take time off and just focus on my family and my health. And then I got frustrated of like hearing people's stories and more stuff about women's health. And I'm like, this needs more. And so I literally went again full circle of like, I got to help more. I got to do it a different way.
Well, and I think that to your point, there's so few practitioners in this country who actually have the knowledge, background, and an experience that you have, starting with L&D, then going into fertility, going into obstetrics and gynecology, and then really understanding this postpartum, then perimenopausal, and then menopausal journey, which in many ways inform one another, right?
Oh, yeah.
And that you've seen so much of women's health journey up front and close and personally, that you not doing anything would be just so devastating. Thank God you came around.
And this is also the problem of like, I think we as women all take on, and our mom hats too, of when we say not doing anything, I was just meaning like, not being a clinician for a while, right? Like, because I wanted to wear solely my mom had, or solely my wife had, or my sister had, or my daughter had. And and that's not a bad thing at all, right? Like, I want to make sure I clarify that. But I got frustrated within my friends calling me or my family calling me or hearing stories. And I'm like, no, that's not what you should be doing. Or no, you should have been offered this. Or wait, why did you walk away in a 10-minute, appointment with 8 different prescriptions with no one telling you what actually they were and doing a true informed consent? So that quickly like jump started of, all right, let's start like a true like wellness women's practice.
So, by the way, not only is she the co-founder of Live Well Collective, but you are the clinical director, where you are leading the practice in terms of hormone health and balancing, metabolic and weight wellness, that holistic menopausal care, sexual and intimacy care. So there are all of these other facets, I think, that women go in for one thing, whatever it is, night sweats, insomnia, and come out being like, oh, I have a whole host of other things that I didn't even know were related.
Because we have to peel back the onion, right? Like people say, or, like it's a layered thing, and it's not just one thing, because we are complex and it's nuanced. And I didn't want to, and this is also a funny thing about me is everyone's like, oh, pick a niche or only just pick one thing. And it's like, I like all things women's health. I like it all. I want women to feel empowered, and I want women to feel educated, and that they have a support or a partner in their journey, whether it's infertility, whether it's pregnancy, whether it's perimenopause, menopause, sexual wellness, weight management.
Yeah.
And I think that's actually, you and I like clicked like that because I think we said something about like cultivating a community, right? Like I think that was the one thing I'm like, I say that. And you're like, I say that. And that is it. It's because it's not just one thing. And so many times in clinical roles, and this is why when we started this, I was very adamant of like, okay, I don't want to be dictated or be told by whatever clinical director we bring in, if it isn't me, to be like, you care too much, Megs, or you just give too much, Megs. You chart too much. You spend too much time, Megs, with your patients, because that is what I've been told in multiple different settings, and it's like, I don't think that's a bad thing.
Right.
Sorry. I want to spend time with my patients and get to know them on a deeper level so that I can truly provide adequate care in just more than a prescription and more than a just see you once a year kind of thing. And when we chatted, the powers that be, they're like, all right, cool, then you can be the director. I'm like, Cool.
Good.
I will.
Okay, so I have a question about that philosophy because to me, that tenderness, that high touch, deep empathy translates into care in the way that you provide it. How does that philosophy impact when a patient comes in? Let's say you're a 47-year-old woman in perimenopause. How do you apply that? Like, what does that look like for her when she comes into clinic?
So, as all my patients will tell you, I start all my consults the same, even though they filled out a questionnaire, they filled out an intake. I have all my notes because I love to prep. I'm a prepper before patients come to me. I like to actually know what they filled out or what they did in their survey. But I start every consult the same, saying, what brings you in today? And I want to hear your story. So
Yeah.
we're going to start, whether it's a 5-minute story or a 15-minute story. Now, if it's an hour story, I might be like, all right, we got to wheel back a little bit.
Yeah.
But I want to hear their story because hearing someone's story, what they first tell me about, that is what matters the most to them.
Yeah.
So what they tell me as like, okay, because a lot of people aren't used to saying that. Like, what brings you in? Like, oh, if you're sick, yeah, my congestion or my cough. But like, this is a different type of care.
Yes, it is.
This is technically, I don't think of it as elective care, but a lot of people do. And I want to hear, is it this abdominal weight gain or boom, I turned 40 and I felt like everything spiraled after that.
Yeah.
And now I'm 47 and my skin feels weird. I have a weird body odor. I 1 week out of the month want to kill my partner and
I don't know what
question
you're
all my
talking
life
about.
choices.
That never happens.
Never, never. I mean, ever.
Yeah.
And so I think that is how I approach my hormonal care of because a lot of those things that they will tell me are tied to different hormone
So, so let's talk about
changes.
hormones for a little bit. And I know that it's, the conversation du jour. But what is your approach to the hormone fluctuation in menopause? And we can go down a rabbit hole of menopause hormone therapy, which I mean I'm here
Hey,
for,
we
or
love it.
or
Hey,
others,
we're
or
here for.
others.
We're here for.
So
Um,
I
yeah.
think it's just a
So
lot of women that this, as Dr. Maris Lambert
chaos
says, that chaos that ensues, you feel it. I mean,
in
women
more
know their
ways
bodies so
than
well.
one.
Yeah, exactly.
So okay. So my first approach always when I talk about hormones is first when I review their history, but also, okay, do we need to worry about a pregnancy
Mm-hmm.
risk, right? Because that is going to change my counseling. And if we do need to worry about a pregnancy risk, are we wanting to combat that with a progestin or whether it's an IUD or a pill, or other ways, or is it something that we can not worry about because maybe that's not a concern or our partner has a vasectomy or
Right.
whatever. So that's always the first. Then after that, or maybe at the same time, it's also, does my patient even is open to
Right.
hormones? So that's also a big thing, right? Because not everyone who walks in here or we talk to
Yeah.
wants hormones. Now, sometimes that's because of the stigma, that's because of
Misinformation.
myths, or
Yeah.
right, they're still living off of their providers who are living on bad data from the WHI, and not being updated. But I think that's where a provider really comes in, and a true person who specializes in menopausal therapy can say, like, okay, is it fear? Is it
Right.
a myth? Like, talk to me about that. Why don't you think you want hormones? And maybe you have a true
Right.
contraindication where the risks outweigh the benefits. Rare, but maybe. Or even if they don't want it, okay, well, there's other options. And it's sort of taking either a targeted
Mm-hmm.
approach or a global approach of their symptoms. And like you said, we could go through the spiral, but then I explain, a lot of women don't even know what true hormones are and what they do and what the symptoms they're having, what they're attributed to, of which hormone that is
Yeah.
or could play a part.
Yeah.
And so a lot of it's education.
It's so interesting. Last week, I had a conversation, and we hear this time and time again, which is, well, I don't want to be on a prescription. I mean, I don't want to put something into my body that I don't. And I think that so many women don't realize that as our ovaries, we think about them as reproductive organs, but really they are endocrine organs. And your body already makes this.
Mm-hmm.
And is a totally protective hormone that you're just putting back in because
Mm-hmm.
that little manufacturing plant shut down. So
Mm-hmm. Mm-hmm.
I think
And
it's
yeah,
just such a mind. I think language matters. I think the context matters because it's, taking whatever, Oxycontin is a different situation than putting estrogen and progesterone back into the system. It's like, lubricating your car. Like it can't work without, I don't know, I'm making a
no,
terrible analogy,
no,
but
I'm loving it. It is exactly that. And it's not only explaining it in that way, but also explaining not all hormones and the route and the dose are the same.
yeah,
And that's a big
yeah,
one, right? All of a sudden, you went from maybe being someone who, oh my gosh, never wanted to get pregnant, so I was on hormones
correct.
and that's all I thought about. And then, oh, I went through my, reproductive years and pregnancies or not. And then now I'm wanting a more holistic or
Yeah,
non-hormonal approach, and now I'm feeling all these effects of estrogen deficiency or imbalance. I hate the word
I know,
imbalance and balancing, but
I know.
we'll
Triggering.
go there. But you know, it's explaining like the hormones when we talk about menopausal hormone therapy or hormone therapy is different than birth control, right? And that I think I do so much education about this is different and the dosing is different. And that, I mean, even to other clinicians where you have no problem handing out birth control, but oh my goodness, you have an issue talking about hormone
A patch.
therapy.
Okay, so let's unpack that for a second, which is to say, and I think that a lot of people get it's confusing, truly. If you, and you brought this up, if you need a contraceptive,
Mhm.
if you are still in perimenopause, meaning you are still cycling,
Yep.
you are
You still have
ovulating an egg,
a chance of
correct. And
pregnancy.
that ovulation could be consistently, every month, or it could be every sporadically, you're all over the place, but you are still menstruating with an egg. You are still fertile. You
Yes.
have the possibility of getting
Possible
pregnant, which is different than menopause.
menopause.
Postmenopausal, you have no period left. And so talk to us about that difference between how you're approaching a perimenopausal patient versus a menopausal patient, and does that change for you?
Yeah. So again, talking about our reproductive risk as far as contraception and what is there, are they open to being like, okay, because true HRT or HT or MHT, whatever we want to call it, like I'm not even going to go into those arguments, is that is not shutting
Right.
down ovulation, right? And it is not at the high doses. And depending upon everyone's approach, you can use a bioidentical, right? So micronized progesterone, estradiol, and that can
Mhm.
come in various forms: a patch, gel, cream, spray.
Mhm.
And so with that, and then that can be, even also topically, which is not systemically,
That's right.
and that is a different thing. I will approach my perimenopausal women because I truly think perimenopause is harder to treat than menopause because it is fluctuating. Because, 1 month you could have no bleeding, and the next month it can be like a crime scene and you're
Yep.
bleeding through everything,
Right.
right?
It is a crime. It actually is a
It
crime scene.
is.
So
It
bad. Yeah.
is. I mean, I had a patient just the other day. She was telling me, Megs, like, I'm like on the slopes and bleeding through my like thick pants.
Yeah.
Like, this is not okay.
Yeah.
And it's not. And women shouldn't have to suffer that way. There are ways. And so we talk about, okay, so is our priority, maybe our priority is better sleep, or maybe our priority is to control that bleeding. And those are different things,
Yeah.
right? So sometimes what I recommend as far as the progesterone or progestin may be different. Maybe we talk about an IUD because we may have better bleeding control.
That's
You
right.
know, maybe we talk about micronized progesterone in its off-label use can help people sleep better. It's calming. So I approach it in that aspect, but letting my patient decide what's best for her
Yep.
and what she wants to try. And then I remind everyone, because sometimes as clinicians we forget, we can pivot. We have more things in our toolbox. So if it's not working, we don't have to force our patient because our protocol says, oh, you have to do this, then you have to do this. Oh, sorry, you didn't do this, so you can't you can't get
Yeah.
this. No. I
So
mean, yes.
I think that toolbox becomes so important. And I think the way that you have framed Live Well Collective as this toolbox, you walk in, you say, tell me why you're here today. This toolbox that you're using, tell us about, because not all women want to do hormones. Super
Mm-mm.
great. Or it can be this yes and, this beautiful yes and, like you get to go to the buffet and whatever you want. I would like the waffle and the omelet. Super. Like knock yourself out, sister. And so tell us about your toolbox
Yeah,
and what those what are
things
those
entail.
lifestyle tips that you're saying, okay, let's do this.
Absolutely. So when they tell me their story, I take it from a whole body
Yeah.
approach. So meaning that it's not just one thing because it never is. So my patients, I have an integrative nutritionist I partner with. We talk about their stress levels, their nutrition, their sleep hygiene, because it is all of those things, how we handle challenges, and then what brings us joy. Like in my intake, I want to know what brings you joy,
Yeah.
because that matters to me and it matters to your health. And so my toolbox consists of things that are going to optimize maybe if we have nutrient deficiencies. So, are we talking about magnesium? Are we talking about vitamin D? Are we talking about creatine? It also entails talking about nutrition. Like I want to know how much protein you're having. And protein is getting a lot of hype, and I get it. There are other things in our diet we also have to focus on. And yes, fiber is right. Fiber is very important. So I always I don't want to just jump on the protein
Yeah.
horse,
Agreed.
even though yes, it's very important.
Yeah.
And then activity, right? Like we all know we need to exercise, but what type of exercise? How often? Are we really straining our muscles and we're, helping build so that we have strong bones?
Yeah.
Because I think if it didn't post yet, because in the fun world of, learning social media and posting and all this fun stuff, I talked about how you cannot talk about longevity without talking about
Yeah.
hormones. And people who are, I'm sorry, you're missing the boat. And I will say it. Okay. But yeah, don't say, oh, I care about your, true health or your longevity without actually addressing hormones. And if you can address hormones, then you probably aren't addressing
Well,
longevity.
again, I think that longevity, I mean, go back to it being an endocrine organ. Longevity is predicated on your endocrine system. So, like, if you're not talking about that, whether it's cortisol, glucose, estrogen, progesterone, like, they
Mhm,
all work together in this
mhm.
beautiful system. So,
I know.
totally.
And not to pinpoint somebody out, but it is sort of funny how some trending people, it's like, oh, I don't do hormone therapy, but I'm a longevity, clinician. How's that
Mm-hmm.
working for you?
Yeah. I'm not saying
Yeah.
anything.
I'm not either, but it really made me
Totally.
mad this morning. So clearly I'm still mad.
Okay. Do you have, because I love certain not hacks, that's a terrible, that's like so like 2022. What are your favorite when a patient comes in, they're like, just tell me what to buy or tell me what to do? Are there things, products, services, like, go get this, it's going to change your life? Chip chat, go get it.
Ugh. Okay. So, one, because I don't think there's one magic pill. I
Right?
don't. and even hormone therapy. It's
Yep.
we aim for 70-80% symptom relief. That said, do I really strongly believe in magnesium helping a lot of functions? Absolutely. And so, not to state one brand or the other, but definitely I think for people, I see more times than not magnesium helping with sleep,
Yep.
digestion, just calming, headaches, you name it. So that definitely is one thing that's like easy peasy, like we can integrate that. Not the be all end all, but
Yep.
definitely something that we can integrate. Um, Different things that I would say as far as like, oh yay, is that the patient also like there's a lot of things I recommend, but that it's sort of an immediate, like, ooh,
Hmm.
I noticed a difference. And these go back and forth, and I'd love your feedback on
Yeah.
it because again, not to I am a provider who tends to take away more supplements, and because I call it the supplement soup, because I don't know about you, but you did hop into your 40s and then all of a sudden your book clubs became like Amazon, hey, I'm going to buy this off of this, or
Yeah.
someone's texting at the end and it's like we all need to be on this supplement. Okay, why again? I don't remember, right? And then they come into me and it's like they're on a whole laundry list of things that they don't even know why they're on. So I'm always very cautious about saying like, oh, these are my 5 supplements that I like, right? Because one, not everyone needs to be on everything
Yes.
either,
No.
right? And I think sometimes I really try to not do harm
Yeah.
by saying a blanketed statement. Everyone needs to be on, vitamin D. Well, maybe you don't, right?
But get it checked,
But
right?
let's
Like,
check. And
let's check
because
it.
a
Yeah.
lot of people do. So I understand why a lot of people say yes. But, omegas are huge, but you don't always tell that they're working, right? Like, and helping your cognition and all that. But they are beneficial. Um, One of the things I actually have started recommending, and I don't, again, there's lots of brands, but is actually monitoring. Like, so all these new things that you can monitor.
Yep.
I used to actually really dislike some of them when I worked in OB/GYN because, people come in and are, oh, my this told me that
This.
this,
Right.
this. But I actually think we're in a stage where people want that data. We're hungry for it. I'm hungry for my personalized, like, what is my heart rate doing? How
Right.
did I sleep? How is, my activity level? And am I in range? And so I would say one of the easier things now in the toolbox of things, and again, lots of companies out there. That's wonderful. I I I would say is telling my patients like let's start tracking, let's start seeing some, whether it's your activity and monitoring your
Yep.
steps and your sleep, and we go from there.
It's so interesting. I was listening to something the other day, and the Aura ring comes to mind, right?
Yeah, I was
So they've,
very cool.
I know,
You said it. I am
it's fine,
very.
but again, choose your own adventure. But what I thought was fascinating, two things. One, they are now calling themselves a health company. I mean, they are a health company. And somebody was saying that their Aura ring in the morning was like, hey, something's going on. You need to be careful. Like, you need to check it out. And by 4 in the afternoon, in bed, sick, like sick as a dog. And the way, and again, maybe it's Big Brother, you again choose your own adventure,
Yeah,
but fascinating in terms of really understanding your body and optimizing for longevity.
yeah,
So again, to your point, is it heart rate? Is it sleep? Is it your metabolic rate? Like all of those things, if you it will tell you,
it does. And
which is
that's the thing.
fascinating.
It is fascinating. And I think that's where we're moving towards is like, we
Yeah.
want to know. Like, I do want to know instead of just thinking, like, yeah, I slept horrible. Like, ugh, like, why do I feel crappy in the morning? Okay, I want to get on my app and see, okay, blah, blah, blah.
And how
And
do I
I
change
mean,
that? And I think it's not just knowing the information, it's saying, hey, yesterday I did X. or I had anxiety or something triggered me X, then I didn't sleep well. I need to change that behavior,
Mm-hmm.
then have positive impact on moving forward, right? If we're not
And
learning,
you can see by, okay, now I changed it. Did that affect
correct,
my heart rate or my sleep? And by tracking it, or, then I can say,
correct.
oh, yes. And that may push those people who need that nudge, that extra support, that, ability to be like, okay, I,
Right. Walking 30 minutes a day, just walking out my front door actually changes my X
mm-hmm,
in a
mm-hmm,
positive direction. I'm gonna commit to walking just 30 minutes a day.
mm-hmm,
Like, no big deal.
mm-hmm. And it goes the same thing with like CGM
Yep.
monitoring, right? Like I used to be very anti. And I will admit it, like you don't have diabetes, you're not
Yeah.
even
It's a
on
polarizing conversation.
pre-diabetes,
Yes.
right? And now I'm like, okay, you know what? Why do we have to be in the red before we intervene? Like, okay, for my patients who have high fasting insulin levels, let's
Yeah.
moderate, let's see.
See what your
And
look like and how we can change them.
hmm.
So far.
It's having that proactive rather than
Yeah.
reactive. And that's, I think, when you do switch from always being in true traditional healthcare settings, and I will say it, it's a sick care model. It
Yes.
is. Like, let's not call it a healthcare model. It's a sick care model. And switching to, hey, let's modernize this. Let's intervene before things are bad, oh my goodness, and see how it changes our true, like, health span. Then that's what we're going to do, and that's what I'm
So
going to do.
how can women meet you, get in touch with you? How do they start to get on this longevity, wellness, holistic, preventative care model?
So I'm in Solana Beach in Southern California, so I do see patients in person in our Solana Beach office. Yay.
Thanks,
But
Dave.
I do but I do see patients virtually all in the state of California. And so we can here, our team can see patients all up and down California, and we would love to help patients on their journey. And so, yeah, our website, you can go and see what we're all about. And really, educating and empowering women and creating this
Yeah.
community like you are doing, and supporting each other, and understanding, yes, you know what, healthcare may not be where we are, but we can change, and together, if it's just by us doing this and we affect one person who's going to go back to her OB-GYN or her PCP and say, you know what, actually I do want to, maybe follow up on this, or I do want to ask more questions, then I feel like my work
We
is done.
did a 30-minute IG live and changed people's lives. Check.
Oprah,
Over.
yes.
I know.
Now this,
I feel like
check.
we need to let her know that we became friends because of her,
Yes.
all the magic.
Oprah, when you're hearing this, because you're totally watching our IG live, like, look at this friendship you made.
So, I mean, I love it. I love it so much.
Yay. Well,
So
I'm so glad we met. I am so glad that it was this instant bond. And I mean, even when we call each other and are like, oh my goodness, yes, this about like this, uh-huh, mm-hmm, yep, I saw this. I mean, I feel like I've known you forever.
same. Okay, well, ladies, we are putting all of this information into the bio. Go call Megan, call her team. If you're in the state of California, get help. She can help you. And we're so grateful to have you today.
Oh, thank you. All right, see you
Okay,
guys soon.
okay, bye.
Bye.